If you have chronic low back pain, this video may help you. My name is Matt Sigua. I'm a physical therapist, and today I'm going to talk to you guys about a case study on Reddit where they talk about having lower back pain. So let's see what they say. So I'm going to read out someone who posted that they have chronic lower back pain despite being in their 20s and they're looking for hope. So it looks like they wrote out what their symptoms are, kind of their experience with their low back pain. So I'm going to read it out loud and then I'm going to take you through my clinical reasoning of how, if I had this patient, how I would treat them. Okay. So it starts with, I am in my mid 20s and I have chronic low back pain in general, but especially in my low back. I've done/do everything you could imagine. Honestly, name it. I purchased several ergonomic or back neck support pillows. I've changed my mattress. A lot of people will do that. Tried sleeping on the floor. I do yoga 2 to 3 times a week. I work out regularly. I stretch often. I eat well. I've seen the chiropractor. They say nothing looks out of place. Even tried self-healing meditations. If I could explain it, so this part looks like it's more specific to the symptoms. If I could explain it, my lower back feels weak, tight, and limited in its full mobility. It's just so uncomfortable constantly. I'm tired of overlooking it. Looking for hope. Okay, so there's definitely a few things that pop out from just reading their statement in terms of what their symptoms are. So one of the first things that in general with low back pain and with any diagnosis or injury, getting a little bit more of the history. So obviously, because I'm reading this, I don't have the access to those histories, but we know that they're in their 20s. So there's a couple of diagnoses that are typical with individuals in their 20s. So for example, herniated disc, typically you see those a little bit more in the 30s, but this person said they're in their mid to late 20s. So herniated disc could be possible, especially with having, more healthy, hydrated discs. You're more prone to disc injuries and disc herniations and such. Now, chronic low back pain. So with that, that can affect a wide range of individuals, and there's other factors including, BMI, so like weight, occupation, are they doing more physical or laborious like work, and then what is their daily routine, right? Like, are they spending a lot of time sitting? Are they doing desk work? So let's kind of break through and go down all like the lines and see what like clues, what they can tell us a little bit more. So they tried a lot of different things. So let's go one by one. They talked about having back and neck support pillows. It's always good to have a supportive pillow, whether that's for your back, for your neck while you're sleeping, or while you're sitting in a chair like this. But one of the things with that is those are nice to have. But let's say this is a student or for work that they just sit for a long period of time. Typically, adjusting the activity, so if they are required to sit for X amount of time, the resolution for those are pretty simple in terms of, okay, you need to change position more often, right? It's not to say that, all right, you need to go ahead and get a standing desk. Standing desks are typically very helpful because then it gets you out of the position of sitting and standing for a little bit longer. But really, what I'll tell a lot of my patients is who have to sit for long periods of time, even if you're just standing up for 5-10 seconds, obviously a minute would be better, but just breaking the cycle of sitting every 15 to 30 minutes, that takes a lot of stress and pressure off some of the soft tissues and structures of your low back and of your hips too, because your hips, for example, your hip flexors, they contribute a lot to low back pain. So whenever you're sitting for a prolonged period of time, what will happen is you can get joint stiffness in the hips and parts of the lumbar spine, but you can also get adaptive shortening. So those hip flexors will get tight because they're always in this like 90-degree like bent position. So if you're sitting too long, that's not good for the hip flexors. They get short. So the ergonomic neck and back support pillows, not bad, but probably not, going to do much to change the symptoms or his pain. He says he's changed his mattress. Mattresses, they can make a difference. I would say more acutely. So, for example, sleep. Let's say this individual was using the same mattress for 10 plus years. usually, your body kind of adapts to whatever mattress you're in, um, unless it's like a, very, very on one end, very firm, very soft. So too stable or very, very unstable in terms of the mattress itself. But usually that's not the biggest factor of why people have a certain pains in the low back, sleeping on the floor. So he said he tried changing the mattress, tried sleeping on the floor, and those didn't help. So the surface that you're sleeping on, it doesn't make too much of a difference. If anything, acutely, if he were to have changed his mattress and then started to experience some of this low back pain, that would make a little bit more sense. Because the stability of the mattress changing from the old to the new, but that's not usually the primary cause. So for this individual, sleep services made no difference. Now, one of the biggest things they talked about where I would say, okay, here's a flag. He does yoga 2 to 3 times a week and he works out regularly. So his movement is something that we definitely want to take a look at. Like, what specifically is he doing in terms of exercise for yoga 2 to 3 times a week? There's a lot of almost extreme positions where you're going to full ranges of extension or bending at the low back and at the hips. So he didn't state that he had increased or more symptoms whenever he participated in yoga. However, that's not to say that some of those positions aren't aggravating, but it wasn't explicitly said. So I'm going to take it as he's able to tolerate it. But I'm curious because usually with yoga, there's different bends, whether that's forward, backwards, and there's also rotations at times. So I'm curious, and I would ask him, in yoga, are there any positions or movements that you specifically avoid or you don't do that maybe the instructor tries to take you guys through and you just stop it altogether? Because that could be very telling of what structures are specifically for him possibly irritated or injured in his low back. And then in terms of working out regularly, I'm assuming that's at the gym, but I'll follow up with, what kind of workouts are you doing? Is it resistance training? Are you doing plyometric training? Are there any weights involved? And like regularly, how often is that, right? Because everyone, has a different idea of regularly. Some people 3 to 4 times a week, that's their regular routine. His regular could be 7 times a week, twice a day, and that'd be possibly overdoing it for his low back. So just some follow-up questions to his workout routine and his yoga routine, because those are typically with general low back pain. It's usually a prolonged or repeated movement or movement patterns that are causing the low back pain to persist, right? So that could be contributed to the working out or yoga. So follow-up questions would definitely help there. And he also says, I stretch often, so probably somewhat related to the yoga. I eat well. If I'm assuming he's eating like less inflammatory foods, less sugar, less sweets and stuff like that. So, that always helps to eat well. He says he's also seen the chiropractor, and they said nothing looks out of place. So assuming you saw the chiropractor, they did some kind of exam, maybe they took an x-ray, and so we're going to, based on that, assume that no scoliosis, no deviations in the actual like spinal structure, as well as possibly the herniated disc, but that'd be a follow-up question in terms of he had an MRI or any other form of imaging. Even tried self-healing meditations, with meditations, they can be helpful too. With pain, especially the more chronic it is, the more of a stressed mental state or emotional state you're in, that can aggravate or irritate your pain symptoms even more. So the mental does play a small part of it, but typically, like I said earlier, the lower back pain, when it's general like this, it's usually because of a repeated or prolonged movement pattern in your day-to-day, and that's why it doesn't improve on its own, right? So a little bit of history or kind of like medical background in terms of most general low back pain. So about 80% of individuals will encounter some kind of low back pain in their life. However, most of them actually will recover within 6 weeks on their own. I mean, that's just the truth. The body will naturally heal, inflammation will go away within 6 weeks, assuming it's not a major injury. So, for example, like a severe herniated disc, a fracture of a vertebrae, something like that, or a torn ligament. If it's not one of those diagnoses, then typically general low back pain will resolve within 6 weeks. Now, for the individuals who their symptoms last longer than 6 weeks, that's when you're in the stage of it being not subacute, but a little bit more on the chronic side. So the pain, the symptoms, they're lasting longer. So with this individual, he falls in that chronic low back pain, general low back pain category. So how we would kind of then try to resolve this, we'd first start doing checking his movements. We're going to do general range of motion. We're going to ask him to bend forward, see how much he can bend forward at his low back, see if he's compensating anywhere, and we'll repeat that with different directions. So we'll do forward, backward, side bending, left and right, and also a little bit of rotation as well. So pretty much we're just checking the different planes of motion for his lumbar spine, because that's going to tell us a couple of things, because he also said he feels limited in his full mobility for his spine, and he feels tight. So then as we check his range of motion and assess that, most likely we're going to find some deficits with one of the directions of the movements, which will tell us, okay, if he's limited going bending to his left side, all right, it could be, a couple of things. One, it could be some of the soft tissues, like some of the muscles on his opposite side. They could be in like a more like contracted state or shortened where they're tight and limiting how far he can bend left. It could be an issue with his left side where some of the joints of the lumbar spine, there could be impingement, there could be just stiffness in some of the space between the bony landmarks of those joints where it's kind of blocking the left bending. So typically if you're bending to the left, in terms of like anatomy, as you bend to the left, there should be a little bit of like gliding motion of the vertebrae along each other to allow you to bend either direction, but especially like to the left. So it could be an issue with the joint capsule or some of those soft tissues or ligamentous structures that are limiting that left side bending. So checking which direction that he's limited in, that can tell us, okay, maybe we need to work on flexibility or relieving some of the tension in some of these structures, or maybe some joint mobilization on that left side could be helpful to regain some of that movement back, right? Now, he also mentioned that his low back feels weak. So another thing typically with low back pain is they're going to have that instability, and that instability, like we talked about, can be from imbalance with some of the tightness in the structures that limit the range of motion, but also the instability is going to be from lack of strength, or at least the muscles of the lower back being unable to activate properly to help stabilize the spine or the low back, right? So then doing muscle testing or functional testing of the low back muscles, of actually the whole trunk, so your core. So we're going to be checking his back extensors. Usually that's one of the more common ones for the direct stability around the spine. We're going to check the front, so the anterior abdominals, just make sure he has good core strength. Also, it's important to check the hips, so the different muscles of your glutes, just to see how the pelvis stabilizers, if they're lacking anywhere, because that can contribute to some low back pain. So we talked about a little bit of him having the weakness, him having the tightness and lack of mobility. So those things are going to tell us, okay, more objectively, we kind of assessed his movement, what he's lacking in terms of range of motion. We assessed his strength, some of the muscles that are essential to provide stability and actually relieve some of the pain because it's not putting too much stress on other structures. Having adequate core strength is essential for low back pain. And now, so those are some of the objective things. Now, you also want to check like functional movement, right? So I talked about a little bit where general chronic low back pain is typically caused by repeated and prolonged movement patterns or movement habits, right? So one of the things that I often seen in the clinic is people have poor lifting mechanics, and this is where people talk about this a lot. Whenever you're picking something up, lift with your legs, not with your back, not with your spine. And it's easier said than done. Not a lot of people look how they think they look when they do these activities. So one of the things that I'll often do is uh, I'll, I'll have them demonstrate them picking something up from the floor. So I'll have them pick up a pen or like a water bottle, and then I'll just naturally like see how they naturally lift up, how they bend, and if they're compensating with their low back. More often than not, usually the spine it'll be rounded. They won't have a neutral spine, and they'll excessively bend at the spine instead of using a little bit more of like hip or knee strategy where they're squatting down a little bit better. So doing some kind of functional movement, whether that's a squat, a lift, will tell us a little bit more of some of their movement patterns. Now, related to that, the functional movement, so actually looking at the motor skills that they do in their daily activities, is actually very related to the general low back pain in terms of recovery and prognosis. So what I mean by that is, for example, there's a study that it took a group of individuals where one group, they received motor skill training. So they had physical therapists essentially go over 3 movements that they complained of having pain and were difficult to do. And the physical therapist helped them practice these 3 specific movements over a period of time. It might have been once a week for 6 weeks. And they would be with them for about an hour. And they would just practice these 3 movements over and over again with correct technique, correct form, and in pain-free ranges, right? So that's the most important thing with that motor skill training is being able to perform a specific activity. For example, lifting a box from the floor or even gardening, right? They would practice this specific movement in pain-free positions and observe how they felt immediately, 6 months, and 12 months after that intervention. At the same time, they also tested just individuals who were doing specifically strength and flexibility related to the low back and the lower body. So different exercises for strength and flexibility. So kind of they use the ACSM guidelines in terms of exercises that they wanted for this group. So the American College of Sports Medicine, they use those guidelines to give them just a protocol of just basic exercises for strengthening and flexibility. And they did that same thing for the same time period. And what they found was that when they compared the 2 groups, the group of the motor skill training that didn't do specifically those exercises, all they did was practice these specific movements with proper form, proper technique, and in pain-free ranges. They found that they reported better in terms of pain scale, functional mobility, in terms of, okay, they were able to do these activities with less pain or better quality than before compared to the group that did just strength and flexibility training. So with that being said, the motor skills training in terms of lower back pain, what we want to do is, what I would ask this individual is more of what does he notice during his daily that he has to do repeatedly that he'll notice he'll have pain with, right? There's always at least a couple things that individuals will have pain with. So that's why investigating as a physical therapist, trying to dig in a little deeper and find out what is causing your symptoms, right? There's always something that they may not be thinking about because it can be something as minimal as changing like the toilet paper in the bathroom. Maybe they're reaching across and they're getting pain, but because it's so automatic, you do this on a daily basis, they don't think about it and they just deal with it. However, like we talked about in the motor skills training study, these movements need to be pain free, and you need to avoid the movements that, or those positions that constantly irritate it, even if it's on like a 2 out of 10 scale in terms of pain. If you just keep doing specific movements that are irritating your low back, even if they are lower in pain, it's never going to allow those tissues to heal and recover. So understanding what he's doing on a daily is going to be very important to addressing his symptoms. Okay, so we talked about checking his range of motion, checking his strength, checking his functional movement, which is going to be super important. At this point, we should have a good understanding, because then we were allowed to ask further questions, but we should have a good understanding of what activities are limiting him or re-aggravating some of his symptoms. Now, what we want to do is, come up with some interventions that he can do. So at this point, one of the things that are going to be the easier, lower hanging fruit, let's say his low back muscles, his extensor muscles, the muscles right next to the spine, let's say they're weak when we tested it, and also he had difficulty just feeling or almost turning on those muscles. So initially, first thing that we're going to focus on is let's activate these core muscles, these low back extensor muscles, and then obviously specific assignment of exercise varies depending person to person. So I'd have to see this individual, but earlier on, it's always safe to work on activation exercises. So this could look like him lying in prone or on his stomach, and then having some kind of cue, whether that's like a tactile cue where like, let's put your thumb right on this low back muscle, and I'll place his thumb over the muscle that I'm trying to specifically target, and I'll say, all right, try to activate, try to bulge this muscle into my thumb, into your thumb, and I want you to feel if you can feel that muscle bulging out in the low back. So with this, that cueing, feeling his low back with his thumb, that's going to give that physical, that tactile cue to tell him, okay, when I try to like bulge my low back, I feel the muscle actually turn on, or I don't feel it at all. Or if I overdo it, I may feel pain, and then now with his thumb there, he can kind of moderate that, and then I'll say, all right, now let's take off 50% pressure, and then he'll be able to feel the difference of when he overdoes it and when it's just enough that he knows for sure that the muscle is turning on. And then that's where it's going to be that safe, pain-free range to practice that movement. So initially for strengthening is like, all right, it's always safe just to activate, right? And then from there, obviously you can progress with increased times. He's trying to bulge out the muscle, and eventually increase range or changing the exercises to a different position. But usually lying on the stomach, lying on the back are good activation positions, as long as he can tolerate those positions. And then in terms of the tightness, once we figure out what side, so the manual interventions in terms of soft tissue massage is easy one that the physical therapist could do, or even the patient could do themselves, where they can get a foam roller, a crossball, massage gun, and kind of work on some of the soft tissues that are tight. And obviously, if it's a joint stiffness problem, then that's something that the therapist can work on hands-on. And those are typically easy to work on. And now with the functional movements, so the motor skill training, that's something that can be done the same day of the evaluation. So how we talked about earlier, where maybe the lifting mechanics is off when the patient is trying to pick something up from the floor. So usually when I test that, I'll tell them what they did wrong and why, and I'll just demonstrate and have them practice that like right there in the moment, because it's fresh. So we'll kind of address that while it happens, and then we'll practice that weekly. So he's doing that often in those pain-free ranges. Okay, so with this case, this sounds like, I've had patients who sound very similar to this, where they have chronic low back pain being in their 20s, and they've tried a lot of different things, sleep positions, mattresses, stretching, exercises. But with these specifically, in terms of exercise and what you want to do with interventions, they are specific to the hips, the low back, in terms of what you want to do and what you want to avoid with the movements. Now, with this rule resolve, if you were to intervene and add some of the things that we discussed here, and I would say one of the things, because then I'm kind of like just doing this on the fly, we talked about how, there's possibly imaging done. Even before we did all the testing, you still want to rule out in terms of double checking for herniated disc, double checking for radicular symptoms, so symptoms down the leg like a sciatica. So before I would even kind of do some of those objective assessments, I would kind of do some of the special tests just to rule out anything that could be red flags or alarming. But based on what he wrote, it didn't seem like those were any problems. So it was most likely just a general low back pain type of diagnosis, which is very typical. Okay, so if you found that interesting, please leave a comment down below in terms of what you want to, if you had any questions about this case, what you want to see more. And if you found that helpful and if you want to see more, please subscribe to the channel, and I'll see you on the next video.